Hi, everyone, and thank you for joining us today for our program called It's Not in Your Head, How to Manage Your Chronic Spontaneous Urticaria and Feel Better. This is presented by Medlive and the Asthma and Allergy Foundation of America. My name is Sanaz Eftekari, and I'm with the Asthma and Allergy Foundation of America. I'm really excited to be joined today by two amazing panelists. We have Dr. Luz Funasher, who is a professor of medicine at NYU, and Carolyn Owens, who is an adult living with autoimmune chronic urticaria. So thank you both for joining us today. The program today is supported by Genentech. These are our disclosures. And here are the learning objectives for today. We're going to get us started with just a poll from the audience. So we'll be really grateful if you guys can fill out this poll. And we want to know about how long did it take to get a diagnosis of CSU? So while people are answering this question, Carolyn, I'd like to hear a little bit about your diagnosis with CSU. Can you just talk to us a little bit about this?
Thank you so much. For me, I'm in category D, more than 2 years. My first flare-up started in early 1997, right before my 17th birthday. It wasn't until my second flare-up, over 5 years later, that I actually got the diagnosis of autoimmune chronic urticaria. Prior to that, I was just in the generic chronic urticaria category.
Thank you so much for that. And you know, we've heard from a lot of people about different stories about how long it takes to get through their diagnosis of CSU. So for this particular program, our attendees have shared with us that they still don't have a diagnosis for CSU. So as we get started, this program is separated into two different sections. So first, we're going to start a little bit talking about what is CSU overall, what are the different signs and symptoms, what's happening to you. And then in the second section, we'll dive a little bit more into treatment and management. So for this first section, Dr. Funasher, I'm going to pass it over to you. And for the audience, if at any point during the program you have any questions, please type them in the bottom of the box as well.
So thank you, Sanaz. Yes, and thank you, Caroline, for sharing your experience with us. So what does it mean when my doctor said that I have urticaria? What is urticaria? Well, urticaria is a medical term for hives. It is a skin rash. You will see raised welts. It's itchy, mostly itchy. Sometimes it can be painful. And there are really two main kinds of urticaria. Acute, if it's less than 6 weeks, they generally don't last very long. And usually you will be able to identify a specific trigger. For example, food allergy or drug allergy or a viral infection or even hepatitis. Chronic urticaria, on the other hand, lasts longer, at least 6 weeks or more, and you may or may not have a specific trigger. When you go talk about chronic urticaria or hives that last more than 6 weeks, there are two main types. Those where your trigger is known, and this is called chronic inducible urticaria, or sometimes we call it CINDU, and chronic spontaneous urticaria, or CSU, where your triggers isn't known or at least cannot be tested. Women are twice as likely as men to have chronic spontaneous urticaria. So what does CSU or chronic spontaneous urticaria look like? Well, you will see three examples here: red itchy bumps, small spots, can start as linear, can be just spots, or can be even huge, large oval elevations or welts. Itch is kind of prominent, and they are very uncomfortable and can even affect your quality of life. And you may feel embarrassed by how the rash looks. This is a nice picture showing you that in darker skin, you may not see the redness, but you can certainly see the welts, and the patient certainly feels the itching. So what else do people with chronic spontaneous urticaria experience? Carolyn, do you want to share with us what of these symptoms you are actually dealing with?
Sure, thank you so much. For me, yes, everything there listed is definitely something I have experienced for sure. Angioedema is definitely a big one for me, my hands and feet. No matter, what happens during a flare-up, at the beginning when it's most out of control, that tends to be the absolute worst part, is when your hands and feet swell so bad that you can hardly use them. You can't wear shoes. Of course, depression, that's another big one on there, because it is very emotionally tough to go through this. Embarrassment, doctor, that you listed on the previous slide, that's another huge one, especially for a female. I don't leave the house without makeup. I don't go to the grocery store without makeup on. So imagine when you're covered head to toe in giant red welts and people have no idea, except by looking at you, that something's wrong. So embarrassment is definitely a big one that I know anyone dealing with this definitely goes through, especially when it's visible and not under control. Feeling helpless, that's another big one. And of course, these kind of things don't even include once you're on medications to try to help. If they're not in full control, you're still taking all these medicines, and then you have all of those side effects and experience all of those extra ones as well. So it can definitely be tough. Thank you so much, doctor.
So you can see how many things patients with chronic spontaneous urticaria actually feel. Some are physical. There's a lot of depression, anxiety, shame, even inability to sleep, and therefore missing work or school in children. So Carolyn talked about angioedema. And what is angioedema? Angioedema is actually a deeper swelling in the skin. It usually affects the face, the lips, the eyes, the hands, or the genitalia. Together with chronic spontaneous urticaria, or there's a small percentage of patients that only manifest angioedema, but about 50% of patients with chronic spontaneous urticaria have both urticaria and angioedema. So is chronic spontaneous urticaria dangerous? It's more bothersome rather than dangerous. Patients with chronic spontaneous urticaria develop an angioedema or a swelling that may affect their breathing, but this is rather rare. And these are the cases when they will need emergency care, especially if the swelling is near their throat. And when should you seek doctor's help? Well, you should talk to your doctor if your hives, urticaria, and/or angioedema is lasting a few weeks. It is out of control. You're getting it every day. You can't sleep. It affects the way you feel every day. Seek your doctor's help, because waiting or delaying or just trying to treat yourself with over-the-counter antihistamines may just not be enough, and you end up dealing with side effects of the over-the-counter antihistamines, or what we call sedating antihistamines. You're not alone, and there are treatments that can make you feel better. When you see a doctor, what are the important information that you need to give them? Your health history is important. Are you on, what medications are you on? Are you on what we call aspirins and aspirin-related drugs? Do you have a thyroid disease? Do you have a history of hepatitis? Do you feel tired? Are you fatigued? For me, seeing the pictures of hives from the patient's phone is very important for me to rule out other things, including inflammation of blood vessels, for example. And a hives journal is also important. It tells me the severity of the hives, tells me how long it lasts, and when it starts. It tells me, are there any triggers to these hives? Is there pain or itching? And of course, it tells me what medications has been tried and failed. What is the cause of chronic spontaneous urticaria? It is an overactive immune system. So there's these allergy cells, they're called the mast cells. They're a type of white blood cells. When they're activated, they release chemicals, including histamine. And what is histamine? Histamine is a substance that will trigger the immune response. Once histamine is released, you can see inflammation, there's itching, there's swelling, and you actually see the hives. Now, for some patients, what are the triggers for this? Sometimes it's autoimmune, meaning there's antibody against some allergy cells that have caused the urticaria or the histamine to be released and causing hives. how is your spontaneous urticaria diagnosed? Well, when you see that with a very good history, the doctor would have a fairly good understanding of your hives, and when they actually see your hives, they will ask you for your health history. There's usually no tests for chronic spontaneous urticaria, but there are some blood tests and some allergy tests that we might consider, we might order to rule out some cases such as medications, allergies, or other conditions. Carolyn, do you want to let us know how your chronic spontaneous urticaria was diagnosed?
Yes, thank you, doctor. For me, my first flare-up, like I said before, was around 1997. And chronic urticaria specifically was diagnosed for me after doing a lot of the things the doctor just mentioned: allergy tests, blood work, elimination diets in case it was something I was eating that I was allergic to. Same thing with ruling out other allergens, detergents, all of those kind of things. So that was the first step. And obviously, when all of those things happened and I was still covered head to toe, obviously we knew it was chronic urticaria. But for me to get my autoimmune urticaria diagnosis, that was more around 2003. And that was, again, after blood work was done. And the first time that we experimented, my doctor and I, with the immunosuppressants, that's when that kind of more verified that mine was an autoimmune condition. And then in 2020, I was quite surprised with the CU index blood test was just kind of the first little thing where they said sometimes can kind of help diagnose a little bit, but obviously there's a lot more to come. So I'm hoping as time goes on that there are more and more ways to help diagnose people. Back to you, doctor.
Yes, thank you. Yes, so autoimmune, the mechanism of autoimmune disorders is associated with chronic spontaneous urticaria. And if it is, we can label patients with chronic spontaneous urticaria of the autoimmune type. And so we can call it chronic autoimmune urticaria, which is what Carolyn has diagnosed, I think. So there's also some association with Hashimoto's thyroiditis and some association with hepatitis as comorbidities with chronic spontaneous urticaria.
And with that, we can jump into some of the Q&A for the first section as well. So thank you both for that great conversation. And it sounds like, Carolyn, part of what you went through to get your diagnosis is trying to rule out if you have specific triggers, right? So if your urticaria is being triggered by something, so it sounds like you went through a lot of trial and error to get to that diagnosis of chronic spontaneous urticaria or just the chronic urticaria. Let's do a couple of quick Q&A from the audience while we're here. So Dr. Funisher, you talked a little bit about the different types of chronic hives, right? So it could be chronic spontaneous urticaria, for example, or chronic inducible urticaria, for example. So one of the questions we had from the audience are hives always considered chronic spontaneous urticaria? Could you just reiterate some of that for us?
Right. So there's this big umbrella of chronic urticaria. Chronic urticaria means chronic, that it's over 6 weeks. And of this, you want to find out whether there's some trigger you can identify or no triggers at all that you could identify. Of the triggers that you can identify, those are the physical or inducible urticaria. And for the spontaneous, a small percentage of these patients, we can see some evidence of some autoimmune phenomenon going on. So most important is it inducible or is it spontaneous?
That's great. Thank you. So with the type that is spontaneous, does chronic spontaneous urticaria eventually go away, or how do most patients, how do they experience these types of CSU hives?
So chronic spontaneous urticaria, generally about half of the patients, it will improve within 1 year. However, if you note that the other half is actually more than a year, and we have a small percentage of patients where it actually may last up to 10 years.
And I think that's really helpful, some of the advice you gave earlier on about even keeping a journal, right? Just keeping track of when do my hives show up? Is there potentially some sort of trigger that you can just see, keeping some sort of journal to share with your healthcare provider? I've heard from a lot of patients is really helpful, so I'm glad you shared that advice. Another question is how to differentiate between something like eczema and chronic spontaneous urticaria or hives.
It's very interesting. Eczema, by the term, tells you that the skin is abnormal. There is what we call dermatitis. But if you look at urticaria, the overlying skin is actually normal because the swelling is under the skin. The urticaria generally goes away in a 24-hour period. It's very itchy, although eczema can also be very itchy. Eczema can last for days and months and even years.
Thank you. Yeah, and that's one of the questions we get a lot is just how to even identify hives from something like eczema, where it might be like elevated skin or swelling, like you mentioned. And then with the chronic part, coming and going over a period of time, and you can't really identify what's triggering that. So with that, I think we're going to move on to the next section. So let's talk a little bit about treatment options and management for CSU. And to get us started, we'll do another polling question. So we'd appreciate if the audience would answer the question on the screen. And so if you are on treatment for chronic spontaneous urticaria right now, how satisfied are you with that treatment? So option A, not at all satisfied. Option B, not very satisfied. Option C, somewhat satisfied. Option D, very satisfied, or option E, extremely satisfied. So we'll give a little bit of time for people to fill out that question. And in this section, we'll start talking a little bit about what's available for CSU and maybe what's even in the pipeline for the future as well. Okay, and it looks like we have most of our poll results in, and the most common answer is C, somewhat satisfied. So we're getting a sense from the folks on this meeting here that it's a little bit of a neutral feeling, right? So maybe a little satisfied with the available treatment options that you've tried out, and maybe some room for growth as well. And so with that, Dr. Funisher, I'm going to pass it over to you. Tell us a little bit about what are the effective treatments for CSU.
So there are different levels of treatment for CSU. There are those that people do on their own. We call it a supportive care. And I would ask Carolyn what she did to help in the itching and in the hives that she had before she went into what I would call a remission.
So since I've been dealing with this on and off for 26 years now, I can tell you the number one thing is do not itch. It's just like a bug bite where once you start, you can't stop, but this is like times 100. Once you start to itch, I mean, I remember itching until I was bleeding because you just couldn't stop because the second you did, all that pain comes back. So I would actually say the number one thing is hands off. Just don't, as hard as it is, fight the urge and do not itch. The keeping cool, absolutely. When you're in heat, everything just feels that much worse. The loose clothing, all of that, again, they're not going to make or break anything, but it's going to give you a little more relief, especially when your hives are not completely under control and they're actual visible and you're feeling them. So, but again, my number one thing is don't itch. Even though it's the hardest thing to control, it is by far my absolute number one most important advice for people. Back to you, Doctor.
It's probably the hardest to do as well, Carolyn, because really a normal response to itch is scratching, and hives are very itchy. But what Carolyn is probably saying also is there is some overlap of what we call chronic spontaneous urticaria and chronic inducible urticaria, because a certain percentage of people with chronic spontaneous urticaria have what you call dermographism, where you scratch it and it becomes worse. And that's because the pressure actually stimulates more mast cells or allergy cells to release more histamine. And that's what scratching does. The other thing that there are certain medications that are not necessarily the cause of the urticaria, but actually makes the urticaria worse. And that includes aspirins and non-steroidal anti-inflammatories like Motrin or Advil. And about half of the people with chronic spontaneous urticaria will have improved symptoms or no symptoms within a year, as I mentioned earlier. So what is the first line of treatment? What do you try first? The first thing that a lot of people try even before they see a doctor is to get an over-the-counter antihistamine, right? Diphenhydramine or Benadryl, they would take it. And there will be some response, but there's some drowsiness that you can get from your antihistamines. And so there are what you call non-drowsy antihistamines, and they really should be the first line of treatment for patients with chronic hives. In other words, try the non-drowsy one. First is it doesn't have that side effects, and second, it's also mostly long-acting, anywhere from 12 to 24 hours. Your doctor can help you choose, and you want to try to achieve your control. First, you can try once a day. If it's not enough, your doctor may prescribe up to 4 times the initial dose. Now, some emergency room and some physicians will give oral steroids if it is very, very severe. Note that oral corticosteroids should be short-term, and long-term use can lead to a lot of side effects: weight gain, bone thinning, skin thinning, and they really should not be used for chronic spontaneous urticaria, because as soon as you stop the steroids, the hives will come back. When 4 times the antihistamine doesn't work, then it's time to start thinking of switching treatments. Also, when you're uncomfortable, you aren't getting relief, you're already taking your medication as directed, and yet your hives keep on coming back, or side effects, you're overly dry from your medications, or you're sleepy with high doses, that's a time to go to your doctor, and a possibility of other additional treatment. At that point, your doctor may ask you to complete a questionnaire to see how you're doing with treatment. And there are some what you call control tests. There are some tests that there are some tests that we do to determine the severity of the urticaria and the control of urticaria. So we call this the urticaria angioedema control test. As you can see, we will ask you how uncomfortable you are and how treatment is controlling your hives. This is something we would administer when you first come in, and periodically when you come in to assess the success of the treatment that we're giving you. So if your initial treatment failed, what are the other options? And Carolyn will help us go through other options that she went through for the chronic spontaneous urticaria.
Thank you, doctor. Yes, so for myself, obviously initial treatments did fail. It's lots of trial and error, but all the flare-ups I've had over this past 26 years, they all start the same way, no matter what. Even though the H1 and H2 blockers, the antihistamines are not going to control my hives, it's still always part of the treatment. However, in my first flare-up, it was that and the oral corticosteroids. The negative about that is that I was put on it long-term and had a lot of very negative side effects and issues during and even after being on those corticosteroids. Of course, I've had multiple flare-ups over the years since then, and I am so thrilled that this past one started in 2020, ended at the very beginning of 2022. All of mine tend to last about a year to a year and a half, each flare-up. that it was the very first time that the option of an injectable biologic was given. So to me, I was like, what? There's something new besides immunosuppressants? And I am just so happy that things have progressed so much over the years, because the biologic is so much better than having to be on immunosuppressants, less side effects. I didn't have to worry about being around people with a suppressed immune system as I would be on the other medications. So the biologic was definitely a much safer option. And even though it took a couple months, 3 or 4, to fully kick in and control my hives, it really was a lifesaver. So even though those initial treatments may fail, there are so many new upcoming things that are just so much better, and I know there's more on the horizon. So I look forward to that for sure. Back to you, Doctor.
That's great. So Carolyn mentioned about a biologic. So let's discuss what is a biologic. So a biologic are medications made by living cells. They generally are given as injectables, usually every 2 to 4 weeks, whereas the usual medication that we see out there, for example, like aspirin, they're called small molecules. Small molecules are absorbed orally, and so they can be taken as pills, and they're generally taken almost like daily pills. So what biologics are available for chronic spontaneous hives? So omalizumab is the only biologic that the FDA has approved for chronic spontaneous urticaria when antihistamines do not work. It is a monoclonal antibody, as I said. It's a kind of protein. And it's available since 2014. So it's been well tested and it's been widely used. We're not really sure how it works, but we know that it does block the allergy cells and prevents the mast cells or the allergy cells from activating and releasing histamine. And as you know, histamine is what causes the spontaneous urticaria. It is a biologic, so it's given as a shot underneath the skin once or twice a month. The first few shots are usually given in the doctor's office, and that's very important because we want to find out whether you have an allergic reaction to it, and if you do, we want to take care of it right away. Subsequently, depending on your doctor's evaluation, you may have the option of getting your shots at home. But if so, you will have to learn how to give it to yourself, and the doctor's office will teach you how to do it. They do come in pre-filled syringes, and it's been FDA approved for patients with chronic spontaneous urticaria, ages 12 years and older, whose symptoms are ongoing despite the use of high dose of antihistamines. What dose will you need? Well, the FDA has approved it for 150 milligrams or 300 milligrams. Remember that these comes in 150 milligram syringes or doses, so that if you will need 300 milligrams, it will come in 2 different syringes or 2 shots. It's given every 4 weeks, and it's in the doctor's office. It's usually given in both arms. As an at-home administration, it can be given in the abdomen or the thigh. The 300 milligrams, as I said, will require 2 shots in 2 different areas of the body. About 9 in 10 people with chronic spontaneous urticaria will respond to omalizumab within about 3 months of treatment. Up to 3 to 6 months, we observe the patient and see how omalizumab will work for them. However, 1 of 3 people may not find a relief with a once-a-month shot. So for these patients, we may have to give higher dosing than 300 milligrams that's been approved, or more frequent dosing. In other words, we can give it instead of every 4 weeks, every 2 to 3 weeks. Note that this is not FDA approved for frequent or higher doses in the United States, but it's been used that way in Europe. After a year and you're completely controlled, you may need fewer shots or you need them less often. Some patients go on into long-term remission after 1 year. How do you know it's working for you? Well, we objectively can measure what we call urticaria activity score, urticaria control test, which I went over that earlier with you. But what's most important is what your opinion is. What do you feel? Do you think your urticaria is under control? We might not see the hives anymore, but if you're still itching, then your urticaria is not under control. What are the possible controls? Well, that you don't have any outbreaks. The end result that we want is that you don't get any hives and you don't get any itching. We want you to be sleeping better. We want you to be functioning at work on your daily activities, and you're not having side effects of the medication. And what are the side effects that I'm talking about? Well, there are severe side effects. Severe allergic reaction called anaphylaxis. It is a black box warning. This is the highest warning that the FDA will issue in any medication. This is rare, but it is dangerous, and that's why we prescribe an epinephrine self-injectable in patients we are giving omalizumab to. This is also the reason why the first few shots of your omalizumab is given in your doctor's office. There are other side effects such as fever, rash, stiff and painful joints, and swollen lymph nodes. If you do get it, call your doctor right away and discontinue your omalizumab. There are other side effects such as just pain in the irritation in the injectable sites. These are generally not urgent, but important to tell your doctor about it. Not necessarily need to discontinue your omalizumab, but it's certainly a discussion that needs to be done with your primary care. What about other biologics? Where these are other agents that are being studied for chronic spontaneous urticaria and even chronic inducible urticaria, and that includes dupilumab or Dupixent, benralizumab or Fasenra, ligelizumab, and lirentelimab. So all of these are monoclonal antibodies. They all target the immune system's activity that is implicated in chronic spontaneous urticaria. Dupilumab is already out in the market, approved for several conditions, including asthma, atopic dermatitis, and eosinophilic esophagitis, and even nasal polyposis. Benralizumab is also out in the market already, and it's been approved for severe asthma.
Thank you, Dr. Funashare. And just to wrap up a little bit before we talk about where to find additional support, it just sounds like there's a lot of hope out there. If you are experiencing what you think might be symptoms or signs of urticaria and just want to talk it through, make sure you find the right specialist or doctor to help you get it diagnosed properly. And then just know that there are options out there and that you can be part of that decision-making process for the options, right? So Dr. Funashare shared at least one biologic that's on the market right now. There's other treatments available. And of course, as she also shared, there's a pipeline of other things being studied. So just make sure that you're talking with your doctor and you're really being a part of that decision-making process. For other types of support, the Asthma and Allergy Foundation of America does offer an online community. You can join for free and you can chat with others who have been through these types of things. So people like Carolyn, who have been great to join us today. So you can talk to others, peers. You can also talk to AAFA staff and volunteers who can talk you through like some of the considerations or maybe who to see. And it's really a great area to just get support for the life side of dealing with something like urticaria. Other resources in addition to the online community that the Asthma and Allergy Foundation offers are things like our support centers. So you can give us a call. There's our number on the screen. We also have different learning opportunities and catalogs, and we have an Ask the Allergist service as well. So anytime you need just some one-on-one support, feel free to reach out to us and we'll make sure we connect you with the right support team as well. And with that, now that we've gone through what to expect or how to diagnose chronic urticaria, and we've talked a little bit about the treatment options and the management options, let's do another round of Q&A from the audience. So Dr. Funisher, just going through some of these questions, I'm going to start with you and let's see. How about, can you tell us a little bit about antihistamines and other medications? So for this population who might be dealing with hives, they may also be dealing with things like allergic rhinitis or hay fever or other types of conditions that require antihistamines. So how do the antihistamines and other medications apply to managing CSU, or do they at all?
So antihistamines works for all histamine-mediated allergic diseases. And as you said, it includes allergic rhinitis and asthma that is allergic-driven. What's important is sometimes with chronic spontaneous urticaria, there is a dose escalation of your antihistamines. You will need higher doses in most cases, and even up to 4 times the recommended dose for chronic spontaneous urticaria as compared to allergic rhinitis or asthma. But they do work for all of these diseases as well. There are medications, though, that can affect your antihistamine treatment or even worsen the urticaria. We discussed about aspirin and other non-steroidal anti-inflammatories. If this is a possible suspect, then you may want to discontinue this other medications that we think might be triggering the urticaria.
Thank you. That's helpful. Another question that we had, and this is something that we hear from people a lot, is that they may have had CSU that pops up and then it gets controlled and then they kind of goes into what you called remission and kind of comes back up again. So one of the questions we had is, my CSU has been controlled for nearly 4 years, but earlier this month, I had a flare-up and it continues. I caught a bad cold, so could something like a common cold trigger a flare-up for CSU?
So it's interesting. Most of the triggers that we can identify is really for acute urticaria. In other words, you had a cold and then you had a flare of the urticaria, but when the cold is over, it tends to get better. There are certain viral triggers for chronic urticaria. For example, there's some association, for example, with hepatitis or with the CMV virus. But generally, you can have a trigger, but generally a lot of spontaneous urticarias that are chronic or chronic spontaneous urticaria may not have identifiable triggers. There are autoimmune phenomena that you can see associated with it, and that's, for example, the autoimmune urticaria where you have antibodies against your allergy cells, or even a Hashimoto's thyroiditis.
So speaking of that, I think that's a great time to bring Carolyn as well. Do you have any experience, Carolyn, with something like a common cold or other types of things triggering your urticaria again?
Not necessarily a common cold. However, I think the more flare-ups you experience, the more you kind of want answers. So it's like when a flare-up happens, it's like, hold on, what just happened recently that could have been a trigger? And it's because you just want to know what the possible trigger could be so bad that you're like, that must be a trigger. I've never had anything to where I knew for sure it was a trigger. And obviously mine's autoimmune, so that probably wouldn't partake too much in it. However, my very last flare-up was actually during COVID. So number one, it was horrible because it was during COVID. You already have high anxiety and everyone's stuck in their homes and everyone's afraid to be around people. But our dog died, and that was it. And it was a week later. And I had gone, it was the longest time span I've had in between flare-ups. Normally, I'd only go a year, year and a half, and then another flare-up for a year, year and a half. I had gone almost 10 years, and it was during COVID and a week after my dog passed away. And head to toe, I was like, here we go. And I was like, there's no way the trigger could be stress, because you think, I've had this so many times. And I mean, I've been stressed a million other times that it didn't cause a flare-up. But my doctor did emphasize the fact that extreme emotional stress and other possible things could possibly be linked. So is it necessarily a trigger? I mean, maybe, maybe not. But I do think that when our bodies are out of whack, that maybe we are more susceptible to flare-ups. But no matter what, I hate to say it, we're going to have them. For some of us, we're going to keep having them every so many years. And I think that's probably majority of us. And then we're always going to look for a trigger and just hope that there's something we can point the finger to, but that's not necessarily the case for sure. But yeah, I did just want to add that in there because I know exactly how that person feels, because we're always wanting an answer. And I don't think anyone's going to be, I know one of the questions was, how satisfied are you with treatment? Well, we're all satisfied to a certain extent when we're not covered, but I don't think any of us will ever be extremely satisfied until there's something that's going to rid it from us completely. Just in my opinion. Thank you.
Thank you, Carolyn. That is an excellent point about bringing up, and you said it so well, about what does stress do. I think stress increases the perception of itch, and when you itch, you start to scratch, and when you scratch, you can start to develop your hives. You also brought up an important point that we are looking at in this allergy division is COVID infection. That's not what you said. You said the COVID stress, but we have seen some reports of worsening of chronic spontaneous urticaria during a COVID infection. So we don't know whether it's a trigger, but we certainly have enough data to say that there are people where chronic spontaneous urticaria that's initially well controlled just gets worse with a COVID infection.
Thank you both. And because we have a little extra time, Carolyn, I'm going to throw a little bit of a curveball at you here because you talked about potentially how things like stress and anxiety, especially related to maybe the pandemic or other things, can trigger urticaria. But let's look at the other side. Let's look at the just the quality of life angle once you have urticaria. So can you talk a little bit about what does it mean if you have some hives or you have a flare up? What does that mean for kind of the social side of your life? What does it mean for your anxiety and stress just in terms of going out and managing things on a day-to-day basis if you're in the middle of a flare-up already?
Right. That's a really good question. And I'll actually take that question into two separate parts. The first part I will say for the younger people, because again, my first flare-up, I was 16, about to turn 17 years old. And I'm turning 43 today, and some of it doesn't change. The fact that it completely changes your life is 100% valid no matter how old you are. However, when I was 16, 17, I'm a junior in high school. How you look is a big deal. I played sports every season. And of course, dealing with that and going to school and trying to be somewhat normal in a sense is extremely tough. I had friends who I know my whole life who would not even talk to me in the hallway. I mean, it changed everything. It was one of those life lessons to where those who stood by you, even though you gained 20 pounds in water weight from oral corticosteroids, even though you could not wear shoes with laces in them because my angioedema was so bad in my feet that I couldn't actually have laces in my shoes. It affects everything, how people, treat you, how you feel about yourself. It makes concentrating harder. Everything in life changed. And the second that flare-up ended, I mean, you really knew who your true friends were because everyone else all of a sudden was best friends with you again. And I'm like, where were you the last year and a half when I was struggling? You know what I mean? Now, at the age of 43, my last flare-up just ended at the very beginning of 2022. It still affects everything. I would say I've always been a type A personality. However, I never experienced anxiety until my older years, and specifically more in my older years of dealing with these flare-ups. My anxiety is at an extreme high, and I actually just started medication for anxiety because it's been so out of control. But it really does have a lot to do, I think, with my condition. I'm constantly worried about getting sick or what might cause a possible flare-up, or, there's just so many worries. The whole thing about, like COVID and everything else. I was so afraid, knowing that I had this condition. I was like, well, what if I get COVID? And what if it makes me go into a flare-up? And what if it makes my flare-up 10 times worse than it normally is? How would I actually survive that? Because it's hard enough as it is. So that concern was just extreme. I didn't want to leave the house. And then when the dog passed, I mean, I was also emotionally just an absolute wreck. And then, of course, a flare-up started. So then what happened? I didn't let anyone in my house. I didn't go anywhere near my husband, my daughter, because I didn't want to get anything. I was so scared that it was going to either cause me to get COVID, and then on top of that, I would also have a flare-up that would just make things completely impossible to deal with, or maybe even impossible to control the hives. So it changed everything. It took a long time for me to actually allow people in my house, for my husband to actually sleep in the same bed with me, because I really was just so afraid of getting any kind of illness that could potentially, be worsened with my flare-up. So it was a horrible time to have a flare-up. But again, it affects every single thing in everyday life. I have just recently gotten back into not being afraid of everything, because it seriously, everything puts me into a panic. So I know I kind of went on and on there, but it affects everything. And for those people who have questions and those people who are dealing with this, you're not alone. You're not alone. It does get better, but it's everything's trial and error, and we're all learning. And I think what we should all be extremely happy about, and I know I am, because I've been dealing with it 26 years, and 26 years ago, it was like, we don't know what to do with you, so we're just going to throw you on all these medications, and hopefully it doesn't last, too long. And now there's so many people dealing with the same thing, so I'm not alone. And that means there's more research and there's more options coming. So I do want people to understand that even though it does affect everything in your everyday life, you can get through it. I mean, you can live life. It's not going to keep you from doing everything. It just makes everything different. It's probably the best way to.
Thank you. And I think that was a really great kind of overview of all the things you've gone through. And I will just reiterate, I think what the note you ended on was a little bit of optimism. So even if it does drive some fear, I will, again, use this as an opportunity to plug the Asthma and Allergy Foundation online community. Please join for free, and you can chat with others like Carolyn who have gone through this and kind of help with empowering a little bit more than just letting the fear drive you. So I'm really grateful that you shared that, Carolyn, and offering some of the resources that we have as well. And I think we have time for one more question. Dr. Funisher, I'm going to ask, are you aware of any soaps or skin moisturizers or any sort of kind of things like that can help with urticaria?
No, there's no specific soap or moisturizers that will help the urticaria, but you certainly want to use fragrance-free, gentle soaps and moisturizers to prevent itching and therefore prevent scratching and therefore prevent aggravation of urticaria. But there is no topical moisturizers that will treat your urticaria. For either urticaria or eczema or any other skin conditions, it's always best to use fragrance-free, non-irritating shampoos and moisturizers. Always keep your skin moisturized, because dry skin is an itchy skin.
Thank you. That's very helpful. And before we wrap up, Dr. Funisher or Carolyn, do you guys have any final thoughts about just kind of your experience managing urticaria, either in yourself or your patients, or any final thoughts to share before I wrap up?
Well, I just want to emphasize Carolyn's journey through all of this, and you can see, thank you for that great story, Carolyn. Although it had a really good ending at this point, to reach that level of control, you went through a lot, and the emotional and the physical aspects of it. I think it's very important for our viewers to realize that the earlier you seek help, the faster you're going to get, hopefully, some relief from urticaria. Don't wait months or years when you are bothered by it and it's not being controlled by your antihistamine. Seek help right away, because the earlier you seek help, the faster you're going to get relief.
I 100% agree with that, and I'm so glad you did mention that, because once urticaria gets out of control, is what I call it, you're right. It is so hard then to tone it back and to get it under control. So I 100% agree that if people are going through this, the longer you wait before dealing with it, the harder and the longer it's going to take to get it under control. So I definitely say, you know, it's your body, and when something like that's going on, you have to take action. Don't wait too long, for sure. But I also do, again, want to say, you know, the AAFA website was amazing because all these other flare-ups I've had, there was no outsource, there was no groups of people like myself to talk to, and you guys having that community is amazing. And like you said, being able to give advice when people ask questions, or people who are just starting out with their first flare-up and they're so scared and they're so confused. It's just such a great site to be able to help other people and help each other. And I really, really am just so thankful for that. And I'm thankful for everyone, the doctors, everyone who has really put so much time and effort into trying to find better treatments and just to continue the progress of helping patients like myself. Thank you.
Well, I think you did an amazing job of closing that out. So thank you, Caroline, for those kind words. And Dr. Furniture, thank you so much for joining us and helping us out with your expertise. So with that, I'm going to say a thank you to my wonderful co-panelists here. A thank you to you guys for participating in the program today. Also, a thank you to Genentech, a member of the Roche Group, for supporting today's program. As another reminder, the slides are available for download in the event resources section near the video box. This program is going to be available on demand. So for anyone who wants to watch again or missed the live session, the on-demand video will be available. And with that, please remember to complete the post-program questions, and that'll help with getting the participation certificate as well. So thank you all for joining. Have a great rest of your day.
Thank you, everyone.